Great, so thanks for coming back. I hope the short film you just watched about the Swiss cheese model made sense. If it didn't, you can get in touch with me. I'll give you my details at the end of this little section. So, in summary, then, there is rarely a root cause to any incident. So, sometimes when things have gone wrong, you will hear people talking about the need to do a root cause analysis, and they might talk about wanting to get to the bottom of what's gone on and find a root cause. That's a bit of a fallacy, really, because rarely is there one cause of the problem. And I think maybe you got that idea when I was talking to you about, yeah, maybe that a human did do something wrong, maybe we did make a mistake, but really needing to understand the why and exploring the things, the latent conditions and the things in the system that cause the problem. So, this is not just me saying this. NHS Improvement are doing a great piece of work at the moment, redesigning the learning and reporting system. So, you'll be aware at the moment, if there's a serious incident declared, there are mechanisms which organisations, whether the CCG or the trusts, need to use to report that to a national level. And it is now considered those systems currently sort of push you to look for one root cause, and we're actually moving away from that to try and adopt this more systems approach to safety. So trying to look more broadly when we do the investigation. So hopefully we uncover, 3, 4, 5, 6 things maybe that go wrong that actually really did lead to the incident happening, so that we can do something about it. Rather than just pinning it on a person or pinning it on one thing that might have happened. So you can maybe see my little chap at the top who's got a magnifying glass is about looking really deeply and trying to find all of the factors that were involved when something's gone wrong. And I've got a picture down the bottom, which is of some logs and of some trees. And in my mind, it's about separating the wood from the trees. It's about getting rid of some of the noise around an incident and getting to really understand the facts of what occurred and why they occurred. So, the repeated asking of why, when you're getting the response sometimes is really important to help you dig deep. So what I'd like you to do now is flick out of this screencast again and watch another short video for me. It's a human factors film. It's only a few minutes long. It's by Health Education England, and hopefully that will pull this together for you before we move on and have a little look at an exercise. Great, so thank you for coming back to me. Hopefully that little video was useful, helped you to think about human factors' role in all of this. And really this sort of builds on that. I think the model we're about to look at, the Yorkshire Contributory Factors Framework, has very much got human factors at the heart of it, and it allows us to take a broader view of what's going on when a patient safety incident occurs. Now, we've got the Yorkshire Contributory Factors Framework. Yes, that is quite a mouthful. And that's not just because we live in Yorkshire. I mentioned them a few moments ago when we were looking at NHS Improvement. They are currently doing a big piece of work to improve the reporting systems and to present an updated model for investigating incidents. And it's most likely going to be a contributory factors based model. The specifics aren't available yet. But I think using this model will get you in a really good position to try and think broadly and get ready to adopt the new NHS Improvement model whenever it's released. So I'm going to talk to you a little bit about this model, which was developed by researchers from the Yorkshire Quality and Safety Research Group, who have designed this model specific to healthcare to help us think broadly. I'm going to put on the website, the site where you're getting all these learning materials from, the original paper about how they did this. So if you want to know more about how they derived or arrived at this framework, that'll be there for you to read. And I'm going to put this diagram and an interview schedule on there for you to be able to look at as well. It'll be a bit clearer, I think, as a standalone document. So, big piece of research that pulled together the key factors that crop up in incidents, and then designed this model, and it was tested to see whether it helped people to draw out the common problems or the problems that were associated with incidents. So if I just talk you through how to use this model, I think then we'll have a little go. So we start by accepting in the middle there has been an active failure, or somebody's made a mistake or had a lapse in concentration. Something has not gone right. So we start in the middle. We then think about, were there any specific patient factors, so we're in the top left hand corner, any specific patient factors that made this incident more or less likely to happen? So when I spoke to you earlier about the nasogastric tube blood incident, there were some patient factors there, weren't there? There was the fact the patient had been suffering from delirium. So it gives a recognition of those kind of things and gets us already starting to think about that. Then gets us to think about individual factors. Were there anything about the individual on that particular day that made the incident more likely or less likely to happen? Had they, for example, been asked to work overtime because we're short-staffed? Had they had an argument with their partner? Were they feeling unconfident? Was it the first time they'd looked after somebody in this situation? The next little piece around the diagram is team factors. What was going on in the team? Did we have all the right people there on that particular shift? What were the team dynamics like? And then moving round onto task characteristics, was there something about the specific task that needed to be carried out that made a problem more or less likely to happen? And then basically we work our way out of the diagram. So we're now in the grey section. We're looking about equipment and supplies. Was the equipment the right equipment? Was it available? Or have we bought the equipment from different providers, making the subtle changes, for example? What are the staffing levels like, and what kind of management decisions were being made on that time? What's the supervision and leadership like? What's the workload like? And what are the lines of responsibility? Is it clear who you should report problems to? As we move further out in the diagram, we can see that there's a big chunk for the physical environment, because actually the environment we're placed in really impacts upon our behaviour. It makes us far more likely to do some things than others. So if I wanted you to, for example, wash your hands very regularly, I could force that function to happen by placing sinks in key places that would make that more readily available to you. Policies and procedures is another section in the blue domain. So are the policies and procedures being followed? Do the policies work? Was there a reason why somebody needed to deviate from a policy? Is there support from central functions? So other areas either of the trust supporting the department, or maybe if we're thinking about primary care, is there support from the CCG or primary care networks? What's the training and education like? So looking, is mandatory training all up to date? Do we send staff on training regularly? And the final one in the blue domain is around bed management and planning. By the time we get to the outer domain, we're looking at things that are quite remote from the incident. So things such as external policy. And this really is recognising that decisions that are made politically will impact on patients right at the sharp end where incidents occur. So I'm writing this screencast to you now as we're experiencing the COVID-19 outbreak, and I'm sure you will be aware of the external policy context. That may be, for example, that the NHS hasn't been very well funded for several years. It may be that student nurses haven't had a bursary in recent years. So those kind of things might be impacting upon incidents that occur. The design of equipment and supplies is the final part of the domain, and again it may feel quite removed from the person who's been involved in the incident and the patient, but this is again really important, because if we can change how equipment is designed, we can sometimes really prevent incidents from occurring. So sometimes it's about going back to manufacturers and asking them to work with us to find different solutions. Okay, so that's the diagram in a nutshell. The other things you can see cutting across all levels of the, all rings really around the diagram, are communication systems, and safety culture. So communication systems are important at every level of that diagram, aren't they? Whether it's at the patient interface right near the centre or right out near the external policy context, the communication systems are vital and need to be considered. And then culture, the safety culture cuts across all domains as well, whether it's from the culture very close to the patient or whether it's the culture very far removed, so it could be at a government level. So then that could be different, it could be the same, I'm not saying one area will be better than the other there really at all, but it definitely applies to all different areas. So that's the model in a nutshell, and I'm going to move on now to the next slide, which is looking at an interview schedule based upon this model. Okay, so this is the interview schedule, and some people prefer using this to the diagram I've just shown you. I'm afraid on the screen it's not come out terribly well, but as I say, I'm going to provide a link to this within your e-learning so you can have a more detailed look at it as a PDF. And it basically goes through the different coloured circles that we've just looked at, asking certain questions and giving prompts and allowing people to tick off factors that they think may be significant. And actually, I've seen this used in a few different ways, really. I've seen it used when people are investigating the incident. I've seen it used when people are investigating the incident, and I've seen it used when people are going to need to talk to somebody about an incident that occurs, and it can be used as a prompt then for them to organise their thinking. It also demonstrates that the organisation is trying to look broader than what you did wrong. So if I was handed this following an incident, I think I'd be quite encouraged that at least they're not trying to just look at what I did. They're trying to consider some of the other factors that were going on at the same time. And I think it really is a useful tool for facilitating those kind of conversations. Okay, like all good teachers, I've got a job for you. I would like you to watch now Gina's story. So this YouTube video will be available for you on the online learning screen under human error. I want you to watch this case. Now, you might have come across it before because we may have used it some other teaching, and that's not a problem at all. I think it's an interesting story to watch, and it's an interesting thing to reflect on anyway. But this time, what I want you to do is jot down your observations, things that you see where there's potential for error. I then would like you to use the Yorkshire Contributory Factors Framework diagram, so either the circular diagram we talked through, or the checklist to help you think about the factors that contributed to the incident. And really, by the end of this exercise, you should have a handful of things that you think led to that situation arising. Some of those things might be latent conditions, some of them might be related to the patient, some of them might be related to the members of staff involved. So the idea is you would have a few things that you think were responsible for the incident occurring. And then we'll have a little talk about what we do with those in a few minutes. Okay, thanks for now.